Strokes are a major health concern, and they often occur suddenly, catching many people off guard. But what if your body could give you subtle hints that something is wrong? In many cases, stroke victims experience warning signs, sometimes even a month before the stroke happens. These signs, though easy to overlook, can act as your body's way of signaling that a stroke may be coming. Learning to recognize these signs can save lives, because when it comes to stroke, time is everything. Early detection and treatment can dramatically improve recovery outcomes, and in some cases, prevent a stroke altogether. Let's take a closer look at the 7 key warning signs that could show up as early as a month before a stroke. 1. Transient ischemic attack, TIA, the mini-stroke. A transient ischemic attack, TIA, is one of the most significant warning signs of a stroke. Often referred to as a mini-stroke or warning stroke, it happens when there's a temporary blockage in the blood supply to the brain. While TIAs don't cause permanent damage, they are serious events that should never be ignored. The symptoms of a TIA are the same as those of a full stroke. Things like sudden weakness or numbness on one side of the body, slurred speech, trouble seeing, or difficulty walking. The difference is that TIA symptoms last for a shorter period, typically only a few minutes to a couple of hours, and they go away on their own. Many people might brush off a TIA because the symptoms disappear quickly, but here's the catch. Having a TIA increases your risk of a full-blown stroke within days or weeks. Nearly 1/3 of people who have a TIA will go on to have a stroke, and in more than 1/3 of cases, the stroke occurs within a month. So, what's the takeaway? If you experience TIA symptoms, don't wait for another attack. Seek medical help immediately, because early intervention can prevent a stroke. 2. Sudden, severe headaches. We all get headaches from time to time, but a sudden, intense headache, unlike anything you've ever experienced before, could be a red flag for a stroke. This is especially true if the headache comes out of nowhere and doesn't seem to have an obvious cause. A stroke can occur when a blood vessel in your brain bursts, leading to bleeding inside the brain. This type of stroke, called a hemorrhagic stroke, can cause pressure to build up in the brain, resulting in a severe headache. If you're prone to headaches, pay attention to the type and intensity. A headache that feels worse than usual or comes on suddenly and intensely could be a warning sign that a stroke is on the horizon. 3. Sudden vision problems. Another warning sign to be on the lookout for is vision changes. You might experience blurred vision, double vision, or even a sudden loss of vision in one or both eyes. This happens because a stroke can affect the areas of the brain responsible for processing visual information. While changes in vision can have various causes, if they appear suddenly and for no apparent reason, they could indicate a stroke or a TIA. In fact, vision problems are a common symptom of a TIA, making it one of the earliest signs of a stroke. If your vision suddenly becomes fuzzy or you start seeing double, don't ignore it. Seek medical advice as soon as possible to rule out the possibility of a stroke. 4. Trouble speaking or understanding speech. Have you ever found yourself struggling to get the right words out, even though you know exactly what you want to say? Or perhaps you've noticed that conversations around you seem harder to follow. Difficulty speaking or understanding speech is another common early warning sign of a stroke. This happens because strokes often affect the part of the brain responsible for language, known as the Broca's area for speech production, or the Wernicke's area for language comprehension. You might notice slurred speech, trouble forming sentences, or difficulty understanding what others are saying. These issues could last for a few minutes or longer, especially if they are part of a TIA. Don't brush off slurred or jumbled speech as something that will pass. It could be an important clue that a stroke is on the way. 5. Numbness or weakness on one side of the body. One of the hallmark signs of a stroke is sudden weakness or numbness on one side of the body. This symptom occurs because a stroke typically affects only one side of the brain, which controls the opposite side of the body. You might notice that one arm or leg feels weak, or you could experience tingling or numbness. Some people describe this feeling as their arm or leg falling asleep, but without a clear reason. To check for this, try lifting both arms above your head. If one arm drifts downward or you can't lift it as high as the other, it could be a sign of weakness caused by a stroke. Similarly, if you feel like one leg is dragging when you walk or you suddenly lose balance, it could be due to a stroke-related issue. 6. Fatigue or sudden exhaustion. It's normal to feel tired after a long day, but there's a difference between everyday fatigue and the kind of sudden, overwhelming exhaustion that might signal something more serious, like a stroke. This isn't the regular kind of exhaustion you might feel after a sleepless night or a long day at work. It's an intense, sudden wave of fatigue that hits you out of nowhere, making even the simplest tasks seem impossible. It might feel like your body is feeling completely depleted, and no amount of rest seems to help. This kind of fatigue happens because your brain isn't getting the oxygen and nutrients it needs, which can occur when blood flow is restricted, as in a stroke. The brain is incredibly sensitive to changes in blood supply, and when it's not getting enough, it responds by slowing down everything, leaving you feeling drained and struggling to keep up with your usual routine. Women may also have other less recognized stroke symptoms, which can sometimes lead to them being misdiagnosed or delayed in getting the right care. The tricky part is that fatigue can be easily attributed to other things, like stress, aging, or a busy schedule. But if this sudden exhaustion is out of the ordinary for you and doesn't improve with rest, it's important to take it seriously. 7. Dizziness or trouble. Walking dizziness or sudden trouble walking is another potential early sign that could be signaling a stroke. Have you ever had that feeling where the room starts spinning or you lose your balance for no clear reason? It can feel like you're suddenly unsteady on your feet, almost as if you're walking on a boat that's rocking in rough water. This isn't just something to brush off. That dizzy, off-balance sensation could be your brain's cry for help, especially if it's happening out of the blue. This dizziness often stems from the cerebellum, the part of your brain that controls balance and coordination. If you suddenly find it hard to stay upright or feel like your body is tilting or swaying uncontrollably, don't dismiss it. And it's not just physical unsteadiness. If you feel confused or struggle to focus on moving your body correctly, that's another red flag. It's important to remember that dizziness is often easy to overlook because people tend to think it's due to something minor, like dehydration, fatigue, or even anxiety. But when it's paired with other subtle symptoms or shows up out of nowhere, it's worth paying attention. This could be your body's way of giving you a heads up that a stroke could be just around the corner. Stay informed, stay proactive, and take control of your health. Please like, comment, and subscribe. Thanks for watching, and we'll see you in the next video.